Thank you, Hindi team. Now we are moving to the English session. Today is our 1706th day of continuous webinar. And today's our speaker is Dr. SADAF ULDE. She is BHMS and Fellowship in Psychiatry. She is the Director of Health Satya Foundation and Binary Institution. And she is a teaching faculty. And she has the 14 years of experience, and today she is sharing some of her clinical experience. Before beginning the session, we will have a silent prayer. So, welcome all the participants for today's English webinar. Thank you for being with us. Thank you, the faculties, for sharing your knowledge with us. And I'm welcoming Dr. Sadaf. I made you as a co-host. You are welcome, please. Yeah, you are the co-host. You can unmute yourself and you can share the screen also now. Okay.
Okay. Thank you, Dr. Anjali. So let's begin with today's session without taking much of the time. So today's case is, so without wasting the time, I'm just going to start with the case so that we can have a discussion on that. And this is a very simple yet complicated case, I will say. So let me begin with sharing my PowerPoint. Just give me 1 minute. So today I'll be sharing some of my clinical experiences. Basically, this case that I'm going to talk about is a very simple yet complicated case. So my approach will be, okay. So first I will narrate the case summary, and then I will go about with what was my homeopathic assessment and prescription, the reflection and outcome, and then we can have a question and answer. So first I'll finish my side and then I will be open to the question, okay? So this is the case of a patient with a foot drop syndrome who underwent a surgery, okay? But despite of the surgery and, the person did not find relief, okay? But eventually when she came to me over a period of time while we were doing our sessions, it came up that she was having a lot of both physical and she was carrying a lot of emotional burden. But before we go ahead, understanding that this is a mixed audience of experienced homeopaths, some patrons, and also students, I'll just give a very brief overview on what is foot drop, okay? So foot drop in itself is not a disease, okay? It's rather a symptom that comes with some neurological, muscular, or anatomical issues, okay? So based on what is the main problem, the scope and limitation of our help that we can offer gets narrowed, or it changes, So for example, the typical symptom, if I have to talk about, is there is inability for dorsiflexion of the foot. There is dragging of toes while walking, high stepping or stepping gait to avoid tripping. There is numbness or tingling in the shin, thigh, and top of the foot. Okay, there is a complete muscular weakness in the anterior leg. Now, why it is so, over a period of time, what I've seen is, as homeopaths, most of the time, either we are too focused on the mind symptoms or we are too focused on the pathology. But how we bring it together is something that is missing in our prescription. And like Hahnemann or great authors like Kent and Robert, they have time and again reinforced that you cannot treat a part. Okay, Bonninghausen said that when you treat a part, you treat a whole symptom. Okay, so what is true for the part is true for the whole. That's when he came for grand generalization symptoms. So similarly, if you're ignoring the pathological completely, saying, oh, this is common symptoms or something like that, you will miss a lot of great remedies. Okay. And I feel to be grounded in your prescription, it's because today we are exposed to so many teachers, so many teaching, so many experiences online, etc., that it can get overwhelming for a new homeopath or even for a seasoned practitioner as to what do I prescribe. Okay. So one thing, for me, I come with a diverse background of working with different homeopaths. So I feel that so much information sometimes can get overwhelming. So in order to ground myself, I always go back to the pathology and try to understand the pathology before I start treating the patient. Okay. So foot drop results from weakness or paralysis of the muscle. That's the main underlying cause. Okay. Especially the tibialis anterior, which are controlled by perineal nerve branch, which is a branch of sciatic nerve. Okay, the most common cause could be a simple compression of peroneal nerve, example from trauma, prolonged sitting, crossing leg, nerve damage during hip or knee surgery, spinal stenosis, multiple sclerosis, stroke, ALS, or muscular dystrophy. Now, depending upon what is the cause, your scope and limitation comes in. Okay, that we can discuss further. Okay, when I say scope and limitation, it means how much and to what extent. So Burnett gave this good concept of how much and to what extent does a remedy act. Okay, so I think that is something which we need to remind ourselves every time when we take patients, and we make sure that we don't overpromise. Okay, so what is the physical and emotional impact of this disease? It's a lot of frustration, loss of independence. The people with foot drop syndrome often have been reported of embarrassment during their walking pattern. Chronic cases, especially after failed surgeries, they often lead to despair, social withdrawal, and irritability. In this case, much of these patterns you will see as I talk about the case. Okay. I'm going to, what are the conventional approaches that you use in this condition? Number one, strengthen the muscles, improve the gait through physical therapy, brace to support the foot, surgery for nerve repair, tendon transfer, and sometimes they give medicine for nerve pain, or nerve tonic is something that helps with the underlying cause. Okay. How do we approach in homeopathy? We will see with as the case flows. Okay. I see something in the chat box. Okay, not for me. Okay, so any messages in the chat box if you're putting, or any questions you're putting in the chat box, I will reply at the end of the session, not in between, because then I will lose the track of what I'm about to say. Okay, so very quickly, starting with the case, this is a female patient. She's married. She's 47 years old. She has 2 kids. She's teacher by profession, very religious. And I am not going to go into too many details and the story or the life space situation of the patient, because that will mean bridging the confidentiality of the patient. So, and because these videos are recorded and it goes on the public platforms, I want to protect my patients' confidentiality as much as possible and yet do justice to the session. Okay. So, key points I will narrate from this case. She had this pain for 25 years. Okay. So for me, it's very important. She came to me with this pain in left leg. She said the pain is accompanied by tingling, numbness. Okay. There is difficulty in walking, difficulty in sitting for a long time. If she's sitting for a long time, because she is a teacher and normally, and she's not like a teacher in a high school or a primary school, there are students who come to our house. And one of the reason why I have to be very careful with this case is because this is a person who does like a complete has a complete screen from the outside world. Okay, so um, she doesn't go out much. So the students, and she teaches female students mostly, and these people, they come to our house to learn from her. And she's quite respected and revered in society also because of her understanding of the religious text and the way she teaches and way she's dedicated in her profession. She gets small youngest girls to eldest ladies coming to her, learn from her. She teaches Arabic texts, she teaches religious texts, and she gets all kind of clients. And whenever they are in, she has to sit for a long time for studying, then for her prayers and for her other religious activities, like when she's kind of meditating or is involved in the prayer, she has to sit for a long time. And when the pain kicks in, it makes it very difficult for her. Okay. So because of the pain that she did opt for surgery. Surgery stopped the pain for some time, but then even after surgery, even after painkillers, even after steroids, the pain will just keep coming back. Okay. So one of the major question for me is, when any person comes with any complaint, may it be an acute complaint, may it be a chronic complaint, may it be simple allergies to cancer, to anything. Okay. I need to understand, how did the pain start and what is the patient experiencing? That are two main questions that comes to my mind. Okay, so if I have to stop my screen share and tell you, this is something that I often ask my patient is, let me take a whiteboard. Okay, so one of the major question is, how did the problem start? Okay, because this answers one major thing that we need to know is causation. We all should know homeopathy is about treating the root cause. Okay. So this for me is very, very important. I feel if in a case you do not have a clear indication of your ailments from, you kind of will be lost. Okay, so for me it's very important to understand what is how did the problem start, or the causation, the onset. So this is onset, duration, and how did the disease progress. Okay, so in her case, she said that it started with an injury. She got some kind of was in some kind of an accident or trauma, and after that she had a little pain. She took some painkillers from a local GP. She was okay, but then the pain kept coming back, and that's when she went and she showed it to an orthopedic surgeon, and surgeon requested surgery. She went on for the surgery, and then she went in for surgery, and then the pain again was relieved, and then again it was to square one. So what I understand is, the main causation, okay, is injury. Okay, so I need to keep this in mind, and how I utilize it, it all depends upon the case, how it evolves. Okay, but I'm not going to keep myself restricted by saying this that okay, I have to only give injury remedies. Although I'm noting this point out, I'm not going to let it prejudice me. Second thing, I know it's a case where already a lot of suppressive, okay, treatment is done. Okay, there is a surgical intervention done. That means there is a structural change already. Okay, so there is a structural change. So there is only limited things that I can expect in this case. So I'm setting up my limitation, I'm setting up my boundaries. Okay, so when somebody randomly calls up and says, hey, I have so and so disease, give me a remedy, sorry, I cannot. Or if somebody says that, hey, so and so patient has so and so thing, what do I do? You cannot do anything unless you have a right picture of the disease. And I can't on a random WhatsApp message or a call say. You need to understand what is happening, reading the reports of the patient, talking to the patient, getting involved. And that is what I have learned in my practice, is that I do not promise my patient beforehand what I can achieve and what I cannot. It's only after 1 or 2 sessions that you will understand the patient, understand the pathology, and then you can commit that this is what I can achieve. Okay. And if you see ethically, medico legally, that's the right way of doing it. Okay. Somebody is messing with the screen, so I will request that do not mess with the screen, because then it distracts.
Actually, doctor, I was accepting someone to the
Oh,
meeting.
okay. So
I don't know.
I'll
Now
stop.
also it's happening, right? Even I was thinking about that. Who is scribbling the screen? That now also it's happening. Now I am not doing anything. I don't
Yeah.
know. Uh,
So I think it's when, when somebody tries to move their cursor on the screen, this
yeah,
lines.
now I am not doing anything, but it is happening. I don't know what
Okay,
happened.
no worries. What I'll do is I'll close the whiteboard and I'll use a word
That
pad
will
or
be
something.
yeah.
Yeah, because that will be better.
Yeah.
Okay.
It makes us
So
disturbed, right?
yeah, so coming back to the case. So
Yeah.
I see that this disease is slowly progressing, and despite of a lot of treatment that has been given to this patient, she is going into regression. Okay. And I have some of my friends who are orthopedics and who are physiotherapists, and they say when the numbness or the tingling feeling starts to come in along with the pain, this is a sign of a neurological deficit that the person is going. That means the disease is steadily progressing, and it's not, it's like the body. And if she continues to do that and she continues to struggle with it, it may also lead to paralysis, or it may also lead to muscle dystrophy. So we have to be very, very careful with this case. Okay. So initially, when I accepted this case, I told her that please take it with a pinch of the salt, that this is not going to be an easy journey. It's not something that you're going to see changes in 1 month, 2 months, 3 months, 4 months. No, it's not going to happen. It may take years of treatment. It may also involve a lot of physiotherapy. Okay. So if your patient is ready to do both of this, it's more than welcome. Okay. So you have to come to a point where you understand, as a homeopath, what you can do. You need to understand the nature of the disease. You need to understand the nature of the person's situations, everything, and then commit. Okay. So that was my first thing when I start, first giveaway or first reflection when I started with this case. And then I'm thinking to myself, her disease is slowly progressing despite of the treatment she's taking. It's the nerve, it's her ability to walk. So what is going against her? Or why is this disease manifesting in her? Okay. Why is she not able to take her foot forward? Okay. So I started asking her more. And for me, once I've understood the onset, duration, progress, and causation, I go and see how is this pain or this disease affecting this person or dismobilizing this person. So she said that she has become extremely irritable. She is not able to get out often. And the pain is taking away life so much. She's like, all and because I'm in so much pain, like simple activities like cooking for my kids, getting my kids ready, or getting excited for their life, that's all gone out of me. So sometimes I feel this pain is taking life away from me. There was this despair. Okay. So when she's talking about her disease pattern, when she's talking about an emotional pattern, okay, the despair, the hopelessness, slowly everything is going. I'm also thinking about what is the miasmatic background that is happening. Okay. She says that this cycle feels like it's never ending. It's because of my religious teaching that I don't want to say this word also, but this pain is so much that I will be okay to commit suicide. Okay. But it's my religious teaching, and I know it is a part of my it's a part of my test and I'm not going to do that, and I don't even think about it. But if I was somebody who was not religious, or if I was somebody who was not so God conscious, maybe I will have done that. And then in her day to day, then she spoke a lot about her family, her day to day activity, in which she was very, she had a very deep, strong sense of responsibility towards her family, towards her people, towards her religion. Very strong sense of conscientiousness was there. Okay. But at the same time, I saw that while she was describing about her family situation, like I said, I have to, if I tell the story, the confidentiality of the patient will get bridged. So I'm not getting into the story, but she was into a situation, okay, where she had to pick up certain responsibilities, certain, she had to take care of certain people in her life, so that she could move, so that those people could be taken care of. Okay. And because of that, like, her husband will not stay with her. Okay. He was living in a different country and she couldn't move to that country because she said a strong sense of responsibility to take care of that person in her life. And this gave a lot of conflict for her. She wanted to go out for, say, some experiences, like just for traveling or tourism. She couldn't take that step. She couldn't go out for any family functions. She couldn't go out anywhere with her daughters because she had to take care of this person in her life. And this kind of created a conflict. She's like, sometimes I feel, why me? Okay. Cutting the story off, the main feeling that came up was she was taking up this responsibility, but at the same time, she was resenting that responsibility. Okay. She was, she will spend time brooding about her situation, brooding about how things are wrong in her life, and as if uh, there is, she needs some supernatural powers to just get her out of this situation. Okay. Nothing is within her control and within her capacity to handle. The whole situation that she was in was making her feel very hopeless, and she was conflicting her own decision and her own will. Like, one side she felt like just throwing this person out into some care home or something like that, or, and another side she was like, no, I can't do that, that's not humane to do. So she was stuck in this conflict of good, bad, right, wrong, and she didn't knew how to do. And then she said, why should I undergo all this? Why is this suffering? And this was, she was drowning in her own sadness and grief. And now I can relate, like, to her mental pattern and what the body is doing, because she's not able to take a step forward in her life. Her body also kind of restricted, the foot drop, you can't move around freely. And that was her mindset also, where she was not, and there was this continuous battle that this disease is doing this to me, this person is doing that to me, that person is doing this to me. So there was this conflict, but the morality was so high that she was not able to, lash out, or she was not able to talk about it in open. Okay. So it was when I asked her to describe the whole situation that she was in, like I said, like a third person, more than the story of the person, I feel the experience of the person is more important. And her experience was that it was she versus the whole world. Okay. She versus her own family, she versus her own self sometimes. Okay. Because she was fighting within herself too. So the conflict, there was a constant conflict, constant me versus you, that was going on in her life. There were too many dreams, they were anxious dreams, they were dreams of dangers. She's in a position where she's not able to get out. And while she was in this position, she was being attacked, she was being done something which will make of her very anxious, very frightful. There were extreme dreams of snakes, and she was in this continuous anxiety state, or deep sense of sadness and brooding, is what I could see in this case. Okay, so how do we approach such a case, and what was my understanding? So at a physical level, I'm seeing a long-standing neural damage, I'm seeing trauma, I'm seeing post-surgical pain, but the surgery went well. The surgery was successful, but then the pain continued. On the other side, we see despair, we see irritability, we see a need to be alone. There was a conflicting personality in front of us. So there was this sense of duality that was going on between her, with high sense of duty, holding the moral grounds, but at the same time, you want to just go and fight with people. So this was something that I could see in this particular person. Okay. So I took certain rubrics. Okay. And in the rubrics, I took mind grief ailments from, mind antagonism with self, will contradiction of, extremity weakness, general while walking, paralysis, religious affection, delusion as if she's neglected her duty, delusion as if she's being neglected, and delusion that she's suffering wrong. Okay, when I put all of these rubrics together, I get naja, anacardium, aurum, lyco, pulse, sepia, lecasis, crotalis, cascavala, hyoscyamus, natremule, causticum, urgentum nitricum, and ignatia. When I look at my repertorization chart, there are few remedies that come up very strongly to me, and how I analyzed it or how I filtered it, we'll go to that next. So mainly I see that there is this, who is this person? So coming back to, I'll just share, or I'll just speak, I will not share anything so that it's easier. So for me, the question is, who is this person in front of me? Okay. Who is this person and why she's suffering? So one of the main thing that I get is, this is a person who is very duty conscious. Okay. Who has a strong feeling of neglect, of being suffered wrong, with intent. There is an impulse to neglect and harm the offending person, but she's holding herself on ground. Okay. There is a strong sense of nobility. There's a strong sense of morality. Okay. But she's being injured by her surroundings. Okay. There is grief in the background. There is this sadness in the background, the melancholy that is not going. Okay. And this person's nerves are getting affected. Okay. It is going towards the weakness. Okay. So for me, out of all the remedies that I see, there are certain remedies that are very popping out. So which remedies out of all of these have a very strong sense of responsibility? So it comes to me, Naja has a good sense of responsibility. Aurum has a good sense of responsibility. Causticum has a good sense of responsibility. And Ignatia has a good sense of responsibility. So now all the other, Sepia has a good sense of responsibility. So now other remedies fade away. And now I have to look at all these remedies which are so strong with responsibility. Let's look at Ignatia. Ignatia is plant aurum, or the plant gold. Ignatia has this strong sense of control. Ignatia belongs to Cancer miasm. Where is our person? Our person is towards hopelessness. It's towards despair. It's towards ending things. Her nerves are giving up, right? So I know Ignatia miasmatically may fizzle out because it's not a syphilitic remedy. Okay. Argentum nitricum miasmatically will fizzle out because it's also it is close to syphilis, but not completely syphilitic. Okay. So now that's also fizzling out for me. Second thing, very important, is Ignatia is a plant remedy, and plant is all about sensitivity and reactivity. Okay. Either they react very nicely or they get composed in themselves. So Ignatia wounds down for me. Argentum nitricum is all about structure. Okay. So it has to, they need a structure, they need a format. They are fifth row, so they are performers. So Argentum nitricum fizzles out for me. And urgentum nitricum is all about show. It's all about performance. It's all about, so urgentum nitricum is, you can say, if I have to give you a best example of urgentum nitricum, it's like a famous superstar, maybe like Shah Rukh Khan, or, I mean, I'm not saying Shah Rukh Khan is urgentum nitricum, but, like at that level, you know, they they are performers. They do everything for the stage. Okay, they are creative, they are involved in the process, they are managers, they are somebody who wants to create, research, manage, bring order to. This female is not interested in that. Okay, it's her story is all about her grief, her spirituality, her morality, good, bad, right, wrong, and she is fighting that with herself and with others. Okay, so urgentum nitricum also fizzles out. Then comes aurum metallicum. In my experience, aurum metallicum holds a very high ground. Being a metal, aurum metallicum comes very close to it with religiosity and everything. But for aurum never expects anything from others. Okay, and aurum is also not about me versus you. Aurum is not in survival zone. Aurum is in this constant phase where I have to do certain things. Okay, I am responsible for, and the responsibility is beyond family, it's beyond me, it's beyond the state, it's beyond the community, it's for at a higher purposes. So aurum comes at a sixth row level. So their responsibilities for a kingdom, so country at a large, world at a large, is what aurum looks at. Okay, then the next remedy that is very close, and my first choice for this patient, is Naja. Because Naja is a very moral person. And if you see this antagonism with oneself, the first remedy that strikes out is Naja. Okay, so it is about, I'm not intruding in your affairs, don't interfere into mine. Okay, their story is they want to do something. So in one of the provings of Naja, the prover was a woman, and she dreamt that she was staying as a paying guest in the house of an old woman. Around the midnight, this woman asked her to vacate the house immediately without any reason and explanation. Okay, and she felt very sad, very bad about it, and she started to, this old lady started throwing her belongings, and she just went out and started to collect her belongings and was about to go out, and this old woman stumbles from the stairs and breaks her leg. She's shouting for the help. At this moment, the prover felt the conflict between her duties and responsibilities. The prover was a doctor, so she said her basic instinct was to go and let her suffer. Okay, she has done wrong to me, now it's her time, let her suffer. But then the responsibility of a doctor clicked in, and she went and she gave aid to the landlady. So they do exactly of their will. So there is this distinct split. Okay, shall I be the mean, vindictive person? Shall I be the one who's ready to take revenge? Shall I be the one who will give back? Okay, or shall I be calm and composed and take up the high moral, noble, responsible ground? This is the conflict of Naja. Okay, so the cobra in India is both revered and respected as a god. Okay, so it's a poisonous snake. Okay, so it's hence pelted with stone or beaten with death. The feeling is of Naja is of being wrong, troubled by others, and yet being dutiful. So that's the main feeling. So when you have somebody who comes and who's complaining, my family members did this, that, blah, 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 they wronged me, they troubled me, they give you a story of torture, they give you a story of trauma, and yet they are very dutiful. And yet they are trying to do everything right, not because they want to do, not because they don't want to offend the person, but because that is what is the morality about. They are doing it against their will. Okay, they are doing it just because of their sense of duty and responsibility in a very emotionally resentful way. So there is this very typical thing that mostly happens, when in family there is a wedding, you come up and say, "Arey, so and so person's daughter is getting married, and I have to give 1 gram of gold to her. Are you happy about giving that 1 gram of gold to that person? No, right? What's the feeling in there? Oh my God, again this kharcha, like again this expenses. It's not something I want to do. But you are excited about doing it, right? That's Ignatia and Aurum. They want to do it. They don't resent the people they're doing. So, oh, so and so Anjali's daughter is getting married, and I want to get a gold for her, right? So this is what I'm excited. And so, the linguistically how you are about it, want to do and have to do. When it is have to do the responsibility, I have to be moral. This talks about you are in conflict with yourself and you're not doing out of willfully. I have to do because God told me to do, but I want to do because I'm doing it for my God. You see how the morally linguistic. So you are religious, but you are doing it because you have to be religious, not because you're excited about it, not because you want to. So that differs Naja from the gold series or from the uranium series of responsibilities or from Ignatia or any plants who are responsible. Plants do it out of sensitivity because they feel so much sadness about the situation that they feel responsible for it. Aurum feels that he's capable of doing things for people and he should do it. It's his moral responsibility and he does that. He's a king. The king will never say, I have to do it. King says, I want to do it, right? If you want to picture Aurum, picture somebody like Bahubali, picture some of the prophets, the way they were, even when they had 5 rupees in their pocket, if somebody will ask, they will just give 5 rupees without thinking, because they loved doing it. They were looking at a higher cause. But here, in this case, you see this distinct split. There is this split that you see distinctly, that I don't want to do it. I want to go out. I want to enjoy with my husband, with my kids. But this thing is there in my life and I can't do anything about it. And now I'm serving this person, but I'm serving with a lot of grudges, with a lot of resentment, and nobody else is bothered about it. Only I have to do it. And so there's this conflict. I am doing the duty. So antagonism with oneself. Sepia also has this a little bit of conflict, but Sepia's antagonism comes up when she's deprived of her ambition. Okay? When she is deprived of her ambition and when she's let down by people time and again. So you have crossed the Ignatia stage, you have crossed the natramute stage, you have crossed phosphoric acid state, then Sepia state comes in when she gets indifferent to people. And then this takes responsibility against her will. So she's gone through all these stages and then she comes to Sepia. And in that, she's indifferent. She's not even bothered. She's doing things for you, but she's doing it mechanically. She's not even resenting you. Because indifference, there's no feeling at all, right? There's no complaining. There is no bargaining, but there is no emotion. It's just a machine who's working. It's a man in a woman's body who provides, but doesn't care to nurture, who fulfills the responsibility, but is not in touch with beauty, love, nurturing, nothing. It's just a man in front of you, in a woman's body. Okay? So that is Sepia. That's why all the desires are gone, all the thing about beauty is gone. So there's a complete alienation of the feminine side. When you look at a Sepia female, they are alien to their feminine characteristics. Okay, so that's another topic to be spoken about, and it's a long thing about, your female archetype and male archetype. I don't want to deviate. So that's the main thing. Okay, so coming back to the case, so what I did with this patient is I started with, after careful understanding, I gave her Naja in 30 200 1M in plus potency, followed by LM potency for a long time. Okay, so Naja is a remedy that is made from cobra venom. The keynote of the symptoms matches beautifully along with the neurological weakness, deep sense of duty and guilt, suppression of emotion, despair, and tendency to withdraw and isolate. Okay. After initial dose of Naja, the pain reduced. She got opportunities. She took out opportunities to be more socially active. They went for family weddings and stuff like that, but the stress still affected her. So the stress triggers still affected her, especially related to her family conflict. It was still there. So because it was like a maintaining cause and you cannot do anything about the situation. So this situation sometime, now when I'm talking about this, this is another important point which I have seen in my clinical practice, is that sometimes your patients are in a situation which, which does not get away or they don't want to get away from, and that causes them to be in this place of maintaining cause. So you need to identify that maintaining cause and see what can be done about the maintaining cause. Sometimes the maintaining cause is the ideas they upheld for themselves and others. Okay, so sometimes in such situations, like I've not put it in the PowerPoint, but in this, because it's not related to the topic, but in this situation, what I did was I did a little therapy with her so that she could detach and see her situation as a third person and take a call based on that. And then again, I repeated Naja 1M because the same pattern, even in the therapy, came up. In her next follow-up, the restlessness had reduced. The pain was still there, but it was more tolerable. She became more quiet. She became more tolerant. Emotionally, she still preferred to be alone, but this time she was trying to navigate her way for herself while she was trying to stand up for herself. And the person who was there, she moved that person to somebody else, and she made some arrangements so that she could have that space. Physically, although the pain was low, the weakness was still there. Okay, especially if she was either sitting for long or standing for long, the weakness came up. So here I introduced another remedy along with Naja. Okay, in I gave just one dose of Naja 1M because I thought that mentally she was getting more stable. Okay, but what needed help were her nerve roots. Okay, the nerves were still weak. So I started her with Califos 6x. Okay, in biochemic potency, they help to regenerate the nerves. So I gave her Califos 6x. Okay, then after 6 months of the treatment, as usual, when patient either get to feel a little better or they are okay, they stop the treatment. These are some practical difficulties you will see. Or they start to expect that something magically should happen in a month or two, forgetting what the disease is all about. She stopped her treatment. Okay, or she started dealing, and then there was Ramzan starting, so I was not going to my rural clinic, and some stuff happened and she stopped taking the treatment. And then after 3 months, she came back to me in October 2022. 3 months she was not taking the treatment. She said till the medicine was on, and then she came right now because she realized that till the medicines were on, the painkillers that she was taking 3 times in a day got reduced to once or twice in a week. And as and when the medicine effect started weaning off, again, she started taking 3 painkillers in a day. Okay. she couldn't get out. She couldn't walk at all. She was staying in a native place, but she came to Mumbai. And there is this place known as Crawford Market. This place is a huge shopping market in Bombay, and you cannot take a car, you cannot take a bike, you only have to walk in this place because it's so crowded. She did walk this place whole time while she was taking medicine. She walked this place, she shopped for Ramzan, and she came back. Although she had pain after it, because obviously it was 1 month and she had already gapped in her medicine. So she did had to take painkiller, but it was after a very severe exertion that she did. Majorly, she could take that step in itself was more than, enough. So after understanding that how medicine impacted her, I know this is a long-term treatment. It's not going to happen like take 3 months, 4 months, 5 months, 6 months and stop. No, it's not going to happen. So I explained her. And at this point, again, I gave her Kali for 6x. And when she was describing this, she said that her journey from the native place from her village to Bombay is 6 hours bus ride. Okay. Plus continuous traveling in the taxis and rickshaws in Bombay, the potholes of Bombay, and she went through all that, and that also triggered a pain. Okay. And knowing her history of nerves and uh, history of injury, I introduced another remedy here is Belisper 1M. I gave her Belisper 1M once a day for 7 days, followed by Kali for 6x. For 2-3 months, I kept her on Kali for 6x. And then, as and when her emotional conflict, and Naja for now was just on an SOS basis because the grief she was holding, the sadness, the antagonism, the conflicts I found was more resolute, and she was taking steps in her life to do what she really wanted to do. And this whole holding up to high moral grounds unnecessarily came down. She could now separate what is a moral ground and what is not. And she was taking an informed decision, not that she became selfish or something, but now she was not resenting what she was doing. Okay. So when I saw that there was an emotional change, I stopped Naja at that point, and I continued with Belis and Kali Phos for her for some times. She still takes her treatment, but now it's not very frequent. It's like only when she's in pain, or if she needs, she calls up. Otherwise, she's not taking the pain. So how do I interpret this particular case or the learning from this case? Okay. So for me, the main highlight of this case is to understand the 3 key layers is very important in homeopathy: the physical layer, the emotional layer, and mental layer. If you see the healing that occurred, it happened from within outward. Although the physical symptoms remain, but they are now manageable, while her mental state is more resilient and more grounded. Okay. Will this case be resolved by analgesic alone? Unlikely. She had already tried conventional treatments for decades. So what is this case teaching us? It teaches us to listen beyond the symptoms, recognize that the pain is messenger, and not to treat the pathology, treat the person. And when you're treating the person, don't just treat the mind, also bring pathology in picture. And one most important thing, which I almost always tell my patient, is journey of healing is not linear. It has to be profound. It has to be meaningful. Do not come to me with a timer on your hand. Oh, it's 3 months, 6 months. If you're somebody who's coming with a timer in your hand, it's not me. You're coming to a wrong doctor. I think you need to give yourself that time, that space to heal, to look into your wounds, look into your conflicts, look above your conflicts, beyond your conflicts, and grow, because pain came to you for a lesson and not for, it's not purposeless. Okay. So if you really want a holistic help, I think this is what is very important. Okay. So journeys of healing is never linear. Okay. So for homeopaths, how will I summarize? chronic conditions always look for hidden emotional traumas. Okay, look into the dreams. Good, don't get lost into the stories. So and so did this, blah blah blah. Story has no value. The value is of what is the person feeling or experiencing in that situation. Look into the physical layer, look into the miasmatic layer. Okay, and then start your healing journey. Just don't give the remedy for the sake of giving it, or by bringing in your prejudice or interpreting, or by uh, you know building some one of your own kind of a thought process. No, that's not how it works. Okay, so whenever you have to heal a person, remember to collaborate, learn and heal. Okay, so it's not like, okay, I'm a homeopath, so I'm not going to go to an allopath, I'm not going to take help from a physiotherapist. No, we have to bring up together, and you have to educate your patient to do that physiotherapy, do that particular therapy, which is the need of the time to heal, especially in musculoskeletal diseases, in neurological diseases. Physiotherapy, along with homeopathy, when done, can create a lot, because musculoskeletal disease is structural change, right? For a structural change, you need a structural remedy too, and that is physiotherapy. So along with physiotherapy, homeopathy, and not just going only into the mind, but also looking into the physically pathological things, when you take one step at a time, you will heal it. Okay, so that's from my side. I think I've crossed my time, in 15 minutes extra I've taken, but over to you all for question answers. Or
Yeah, we have
any
5 minutes, 4 minutes for the questions. But it was really, really wonderful, and it was crystal clear. And when you are comparing the medicine with another medicine, it was very clear to the participants about the medicine. I really loved your presentation. I think all the participants. Thank you so much for a wonderful presentation. And participants, if you have any questions, please raise your hand and ask questions within these 4 minutes. I think no one has any questions. Anyway.
Two possibilities: understood everything, understood nothing.
It will take time to come forward. So
yeah,
we have, Ram Parvesha sir has raised hand. Okay, sir, you can ask.
Thank you, Andini, and congratulations, Dr. Ahmed Madam. Very nice presentation. Yes, is a very good. Describe the
Dr.
case.
Ram, I'm interrupting you. My name is Sadaf, not Ahmed. The screen name is
Sorry. That's Sadaf Madam.
That's my brother's name.
Just thank you. Very nice. This is the neurological and just like paralysis like tendency, and these the physical, emotional, and mental symptom. And select remedy, Nada is a very good remedy. Nada is a very good remedy in paralysis and mental and emotional symptom. So very thanks, Dr. Sad Madam. Very thanks.
Thank you.
Thank you so much. And on behalf of IFPH, it was a rare and clear presentation. And the way you are comparing each remedies, it was clearly defined. And thank you so much. On behalf of IFPH and from myself, for all the participants, I'm for coming here. Dr. Manoj, do you want to say anything?
Thank you.
There is no doubt about her potential, and
Yeah.
we are very proud of these fellows because they have you just mentioned about the crystal clarities, everything. They are the real promising physicians, and we are very happy to listen from them. Thank you.
Thank you so much.
Thank you. Now we are moving to the Malayalam session. I am inviting Dr. Manoj, who is
Yes, myself.
Okay, I'm inviting Dr. Manoj for moderating Malayalam session. So bye-bye to everyone. Good night. We'll see you
night.
the same time. Dr. Sadaf, yeah, thank you so much and good night. Come again.
Sure.
As you said, the sepia is, we will define sepia in another time. You have to explain about that because that will stick on our mind.
Sure.
Okay.
Yeah.
Okay, Dr. Manoj, you can proceed.